I'm Greg Jamian, and thank you for watching Boomer Health at Home, the show where we explore the most relevant healthcare topics impacting the baby boomer generation today. As more and more baby boomers seek answers to many times difficult healthcare questions, our goal is to provide ideas, tips, and cutting-edge solutions that will help improve your everyday life and health. It is our hope that you find the following information helpful as you sit back and watch Boomer Health at Home.
Hello, I'm Ryan Donnellan alongside Brett Pulte, and you're watching Boomer Health at Home, the show where we aim to bring useful information to you and your loved ones to live happy, healthy lives. Thanks for tuning in. Brett, thanks for being here today.
My pleasure.
So, Brett, what are we talking about today?
Today we're actually going to be talking about how to bring together all types of healing. And we actually have Jennifer Hicks in. She is not only a registered nurse, but she also has done a lot of research and actively works in holistic medicine, alternative medicine, pretty much combining everything.
Very good. I know it's always kind of an interesting topic when you look at the different medicines out there, and it's intimidating. You almost need a medical degree to take it. So,
that's the cool thing with Jennifer. She has the medical degree, but she also does have the knowledge of the holistic approach.
Great. Well, for more information on how you can take ownership and control of your own health plan, stay tuned. We'll be right back. Welcome back to the show. You know, on Boomer Health, we really try to aim towards keeping you happy and healthy at home, and do so by providing the most current, up-to-date information on different health trends in the field. And nowadays you hear a lot of talk about alternative medicine. So joining us today is Jennifer Hicks, RN and Integrative Health Specialist from AmeriCare, to kind of shed some light on that. So Jennifer, thanks for being here today.
Thank you. Thank you for having me.
Of course.
It's an exciting topic. So there's the words that you may hear are alternative, complementary, integrative, or holistic. Holistic, alternative, complementary, those are older terms. So 70s, 80s. Integrative medicine is combining them, so it's not an either or. It's not that you either go to your primary care physician or you go to a massage therapist or an acupuncture. Integrative medicine is bringing the best of both worlds together.
Wow.
So integrative is bringing Ayurvedic, Chinese medicine, naturopathic medicine, nutrition. It's combining them.
So there's a lot of different paths out there. So now we know you're an RN. What has been your experience up to this point in the trends you've seen in the healthcare market, where I'm sure you probably have seen some of these trends become more popular and all that. What is your experience with the integrative health market?
What I'm finding is the doctors, medical doctors, traditionally trained, they are learning more about nutraceuticals, or now you may be going to a primary care physician and he may be recommending that you're taking a vitamin B or multivitamin. So, or you'll walk into a clinic, a doctor's clinic, in their office, they're going to have a naturopath. They will have an acupuncturist. Beaumont Health Systems, they have an integrative center, as well as Henry Ford. So they're bringing together all the modalities, so the person is getting care from all sides.
Okay.
So it's a great trend. It's becoming combined. It isn't an either or again. So.
Right.
Yeah, and as you said, holistic and alternative medicine, everything now is an integrative. But what makes something, what defines something as holistic medicine?
Okay, so holistic was, the meaning behind that, the definition of it was the whole being. Mental, emotional, physical, and spiritual. So generally in traditional medicine, so I'm going to say Chinese or Ayurvedic, they would consider all of those. They would consider spiritual, emotional, mental, and physical. So one of the beauties of what we consider or call Western medicine is it was very focused on the physical being and the symptoms in the being. Being meaning the human being.
Right.
All right, so if you are in an automobile accident, our Western medicine, it's a trauma situation. We have so much technology and there's so much science behind how we can help and save that person. If so, you will be saved. You know, your limb will be saved, your life will be saved, you'll be sewn up. So in our medicine, there's a lot of diagnostic capabilities that maybe in the holistic situation they weren't able to do because of our imagery and, you know, CAT scans, MRIs. So holistic, so we were really, really good, and I'm saying we as in Western medicine, as a registered nurse, at the physical body. The nervous system, the vascular system, the muscular system. And combining holistic, which they are looking at, they too were looking at that. I'm not saying they don't, it's just bringing them all together, bringing all those theories together, were able to help the individual completely. So on that holistic, mental, emotional, physical, spiritual.
Great, and you kind of mentioned it in the intro there. So it really sounds like there is a difference. I think people just lump it all together. I think holistic is all different, but it sounds like there's complementary and there's alternative medicine. Can you elaborate more on the difference between those two?
Sure. So this is it. So this is great because everything is changing and evolving.
Yeah.
So complementary and alternative, those were definitions. They're similar to holistic. So it was trying to define or to distinguish what traditional, I'm going to call traditional being at this moment Western medicine, compared to, let's say, acupuncture, Ayurvedic medicine, massage, chiropractic care. Those were called alternative. It would be the alternative to the norm, or complementary to what we were considering the norm. It was an either-or situation.
Interesting.
And oftentimes there are still many people who see it as an either-or, but it's really not. It's integrative. So more and more are coming together to see how they can help one another. Is that helping, or am I not answering the question?
No, that makes sense to me.
Yeah,
Okay.
It definitely does.
Yeah.
So it kind of sounds like, you know, you want to have everything together, but in our society, do you think that you still have to choose one or the other?
No, I don't think you have to. Well, okay, that's a great question because it depends on what the situation is.
Okay.
So yes, I would say there are times that you would choose one or the other, particularly if it is an acute situation. So I'll give a quick example of myself. I had pain in my shoulder. So initially I tried massage, I tried deep tissue massage, I tried craniosacral, different therapies. Then it escalated to a point where I developed frozen shoulder. I could not move my shoulder. Prior to getting to that, I did go to my primary care. They didn't, they gave me exercises, sent me to a physical therapist. It then escalated to that point where it became, I was immobile with it, and I went to an orthopedic specialist. He then gave me an injection in my shoulder. I went to physical therapy to help me get some different mobility with it, but I also went to an acupuncturist. So the acupuncturist then helped my whole body kind of deal with the whole stress of having a immobile shoulder, and he then gave me different treatments so that I could then move my shoulder more. So it's a great question. Yes, there are certain times that you have to go to a primary care physician and they may refer you out. So initially I tried treating myself through massage and maybe not, just a more simplistic way.
That's interesting.
Yeah.
So yeah, I mean, actually, I mean, you hear stuff like that. Like I've had a family member that was suffering from frequent heartburn, was going, doing all this stuff, and was taking, the different antacids. I mean, like 2 or 3 a day. I mean, it was like a lot. So they looked for something, and I talked to him recently, and they said he actually healed it in a way by just having an apple with local honey every night. He said, really? He said, where'd you find that? He said, we found it on the internet. He said, it helps with all that. I said, you kidding me? So just an apple with all that actually reduces. So he wasn't getting the nighttime heartburn like he was getting. Just like, so yeah, I guess like the different drugs out there can treat a symptom, which is kind of the traditional, or an alternative medicine. Now, I think he still had to go and get tested with the scope to see, make sure it wasn't an ulcer and all that kind of stuff. That's,
correct.
So
yes.
that's
yes.
where it's integrated.
Right.
You got both kind of concepts. But yeah, he was able to sleep at night because he was eating apples and honey. It's like, wow, okay, interesting. So.
Right. Right. So we are kind of, there can be this, I'm going to say, a quagmire of all this information, and there's so many different specialties, and what do you do? That's a great example. And it's not an either-or situation, and that's where it can start to become a serious situation if someone is not talking to their primary care physician, or let's say someone has a mass on their arm. Probably it's a good idea to go to your doctor. Yeah. It isn't something that you're going to want to ignore. Because it's best to first get it checked out to make sure it isn't something serious, and then try and deal with it through your diet, nutrition, exercise. And that goes along too with these, the integrative and the holistic. So if you start exercising, we have available to us all these different health clubs. We have personal trainers. You have people who can come into your home. They're senior citizen movements, and so senior citizen places that you can go to get even massage.
Yeah.
Interesting. Well, that's a good question. You said places you can go, and I think, there's no mystery anymore. Everyone knows that the big drug pharmaceutical companies are in their business to make money, and unfortunately, I think sometimes people have gone down the route of pushing more drugs, probably over-prescribing drugs, need be. So I think that's where this push of alternative holistics going on. So if someone does want to say, I don't want the drugs, but I still want to see a doctor, what is your experience? How are the hospitals respond to this? Because it seems like there's money involved, so it seems like there's always a little bit of resistance. Is this?
You know what, so this is my opinion. I'm not speaking on anyone's behalf.
Sure.
So I don't, what I have found is that oftentimes money does generate change. Our choices of how we are going to spend our money is going to generate change. I think that's probably what happened as to why the hospital started to get integrative medicine, because more and more people were going to the alternatives. So we always have to take responsibility for our choices. That's the bottom line. Mm-hmm. By that I mean, we are responsible. So is it in my best interest if I am on a blood pressure medication to all of a sudden stop it without talking to my doctor because I'm just tired of taking that drug? No, that is not really in my best interest. This is just a scenario, okay?
Yeah.
I would say go talk to your doctor. If you're not getting the answer that you want from that doctor, talk to someone else and say, look, I need a doctor who is considering vitamins and my diet as how I'm supposed to eat. There are medical doctors who are combining those.
Yeah.
And then go to them, and they may say, well, let's start it this way. Let's start making changes in your diet and see if we can lower that medication. So you're correct. There has been I don't want to throw out words that people may misinterpret. So let's just say, yes, was it always for the best point of the person? Possibly no, but I don't know that it was done to create intentionally malfunction in the human body or death to people. But once again, people were at a point where they just wanted to pop pills and not change things in their lives either, right? So now we're at a different place. People say, no, I want to take more accountability, and ultimately it's accountability. It is accountability. We are always accountable. We are accountable to whom the doctor we go to choose to go to.
Yeah.
Yeah.
I think we're fortunate here in Oakland County, especially. It seems like all the major hospitals all have bought into it and are providing a lot of programs. It looks like more and more every day. So we're very fortunate to live in this time. I mean, there's a lot more out there.
There is.
Yeah.
And as you said, you're finding more and more doctors bringing everything together.
Right.
But I would think that a lot of our viewers still don't have a great idea of what's going on. So, what are some common misunderstandings about integrative medicine?
Okay, so I'm going to say there's so common misunderstandings is to integrative medicine. A couple. It isn't voodoo. Okay, it's not voodoo.
Yeah, people get afraid of it. It's like magic or something.
Right, exactly. There is science. There are studies done behind them. Ayurvedic and Chinese have been around for thousands of years. The other thing is too, it's not an either or, and I think that's where so many people on either side of that fence that you're standing. If you're standing on that, there's a side of the fence, right? There's people who only want to go to alternative medicine or integrative medicine. Well, integrative is the both. So there's people who think, no, all doctors are bad, all pharmaceuticals are bad. It's not that way. And then there's people on the other side who feel that that's quackery. It's all quackery. All of it is quackery.
I like
right?
the word quackery. It's just fun to say.
Right. So it is truly, it's not that way. So the misconceptions, I would have to say that there are some misconceptions. There are times where the tumor is life or death and it is threatening. There are times if you are, you've had a traumatic brain injury, no, you really do need to go see your doctor. You need to go see specialists. There are times for that. But will it matter what kind of foods you eat after this? Yes, it does. Will it matter? Maybe acupuncture will help with the meridians and opening up the different channel of energy, because ultimately we are energetic beings. If you look at an EKG, there are electrical impulses, right? So it isn't, it's just so much more magnificent and wonderful than oftentimes these little pigeonhole boxes we've given everything.
So essentially, I mean, just put it in,
A nutshell?
Yeah, so like, if you're sick, you need to be diagnosed, and that's where it comes out. And you need to heal. The healing needs to happen no matter what. But your body's constitution, how you set your body up to begin with, will impact how well you heal and how well you feed. Is that kind of what you're saying? Okay.
Yes.
That's how. All right.
I think so.
See?
Yes.
You told me before I wouldn't get any of this, but I got a little bit. Yeah. I'm going back to sleep now.
Did I answer that question that you asked? Because I thought it was a very good question.
Yes, of course. Yeah.
Okay. So you're right, and also what plays into it is the person's outlook and their own, how much they want to be involved. Are they a pessimist or an optimist? It's kind of hard to be an optimist when you're in a great deal of pain. So
yeah, that's true.
Right. So that's how sometimes there are medications to help relieve that pain until you can help the body to heal. Yeah. And then you're still going to have to push through it. But at that moment, that acute moment of pain, you need the medication.
Sure.
Yeah.
Perception is always reality. It's amazing when people are, they just live and get tunnel vision on it. So
you're right.
So you kind of mentioned, like, when this is new. This is, like we mentioned, this is a good time to live. But of course, with this time, we have many generations. Like, we have like an interesting sandwich generation. We do the baby boomer generation, all that. I guess the question is, generations kind of hold on. Well, hey, my parents didn't do that, or this, that, it's kind of, the ball gets rolling by where the impetus started it. And what has been your opinion? What's the biggest change you've seen, good and bad, in the general health of our population over the years? What have you seen as a trend?
What I've seen is, it seems like there was almost this 30-year span of eat whatever I want, do whatever I want, without paying any consequences. Or the body was seen also as a machine. Basically, we were seen as a machine, which we're not. So I feel that we are in this time exactly of what you said. So the younger generation, obviously, they're seeing things they do and they don't want, and they're picking from that. And then there's people who've been living kind of status quo, and they kind of, I don't want to say, the status quo are actually the 30, 40-year-olds. That's what I would say. The baby boomers, my generation, they're like wanting to get more active, I think, because they're seeing how precious life is, and there's all these different things open to them. And then there's the 90-year-olds or 80s, 70s, and 80, 90-year-olds. And so a lot of them were thinking, the ones that are still really active and healthy, they just kind of, I think, took responsibility for their lives and did live the way they thought was the right way to live. So the trend, I guess, that I'm seeing is the good and the bad is we are in a state where there is more responsibility now on the actual individual.
Okay.
That is a positive and that's a negative, because there is so much information. Where do I go from here and who do I talk to? And so I think that's kind of that's a positive and a negative. And then the other thing that I'm seeing is healthcare in general, and this is my opinion, seems to be this big, huge, massive ship that's out of control as far as expenses and the care that the patients get. And realistically, I think we're at this great, great change. And so we're all trying to help. And the way that we can help one another is to actually try to stop. I'm saying myself as a nurse, to stop and look at the patient in front of me and see everything that I can do for them, as much as in my ability to help them. And then the patient has to actively participate.
Sure.
And that may also then be, if the patient isn't healthy enough, then their family member has to come in. So that's a change too. So then more and more people are having to go to home care. So I know this is a whole different discussion, but
this might be another episode.
Right,
there, but
right.
It's interesting, like, we got a lot of power at our fingertips now and all that. And it's like my Uncle Ben always told me, with great power comes great responsibility, and we need to take on that responsibility.
Yes.
It was a Spider-Man reference,
Oh, I'm sorry.
by the way. I caught you.
Very good.
But on the vein of change, someone who's only familiar with traditional medicine, why do you think that they would be interested in alternative medicine?
That's a great question. It may be if they have, it may be, let's say they're, it has to do with their balance. Let's say that now they're older and they're finding that when they stand up, they just don't seem to have the strength that they want, that they once had. They don't have the balance. They don't lean over and pull the shade down like they did. Now they are off balance. Okay, and I'm going to use alternative medicine or integrative medicine in this way. They might not think. They may actually be of the mind that physical therapy would be an alternative medicine. It's not. That is not an alternative medicine. That is part of our medicine, but. And someone who's older and more traditional, they wouldn't have had someone come out to their home and teach them exercises. They feel that that's a little, why do I need to exercise? I'm 96 years old, I'm 95 years old. But that's an alternative, and I can't tell you how many patients I've had after they've had physical therapy say, that was really great. Now I can stand up, get out of my bed, and I have my balance. It has to do with muscle strength. Yes.
That's great.
It's really interesting.
So I'm sure there's people at home and that are interested and probably now wondering, like, hey, I guess that's, maybe they're feeling exactly what you just said, and they want to take a different approach or just try, second opinions. There's also second approaches.
Yes.
To that person looking for a second approach, what do you recommend to them to get started?
Ask someone. If you know, okay, so first what I would say is ask someone you know who may be doing it. If there's no one within your group who knows anything about it, ask your child. It depends on how old you are. So if you're in your 80s or 90s, ask your kids. They probably know. You can go on the internet. You can go to your primary care physician. You can go to, if you're more comfortable in Beaumont Healthcare System or Henry Ford Healthcare System or U of M, go to that, or Mayo Clinic. You know, they'll start giving you information. If you want something more locally, you can Google it. You can, I'm trying to think of, sometimes a senior citizen places will have information. There's health fairs. That's a great place to start, or at health fairs. I wouldn't say look through the yellow pages because that's obsolete, basically.
Right.
So you'd go to the library, go get a book out.
Well, I know here right in Bloomfield, the Bloomfield Community Center for the Senior Community Center has a lot of health fairs and some great stuff that resources available too.
Yes.
Well, that's great. It's a lot of good information. We are unfortunately running out of time right now.
Okay.
We could sit here and talk all day long. So first off, thank you for coming on. Thank you for sharing your wealth of knowledge. And for anyone back home, if you have any questions about any of the content you saw on today's show or even any previous shows, you can contact us at area code 248-288-2270, or you can drop us an email at boomerhealth@americaremedical.com. Thank you for watching.